For far too long, African Americans across our nation, our state, our region, and right here in Buffalo have suffered from the devastating impacts of racially based health disparities.
African Americans who live in the inner city of Buffalo, they're going to live about 12 years less than whites who live in other communities. All the medical science is showing us, and the data is showing us, that it's the social determinants of health. It's the living environment. It's the economic situation. It's the access to quality education. It's the access to fresh fruits and vegetables. And all these things are a real problem in our community.
There is diabetes in my family. There is heart disease in my family. This is my history.
The east side of Buffalo has been unfortunately overlooked for decades, but the University of Buffalo embraced the obstacle at hand and said it is time to engage and to fix these disparities once and for all.
It's a great pleasure to introduce a UB Institute that we anticipate will have an enormous impact in our city and for our neighbors, the Community Health Equity Research Institute. The mission of the UB Community Health Equity Research Institute is to perform research to understand the root causes of health disparities, and also to develop and test innovative solutions to address these pressing problems in our community.
We challenge UB to use the brilliance contained within their schools of medicine, nursing, education, urban studies, business, social work, and other disciplines to do something that some may believe cannot be done.
By advancing a culture of equity across our region, Buffalo will be known not only as the city of good neighbors, but a city where each of our neighbors, regardless of skin color or socioeconomic status, can achieve optimal health.
You've already done the huge step. You've acknowledged what the problem is. Now you're going to come to us soon and tell us what the solution is and how it's going to get implemented in Buffalo.
We have some unique approaches in Buffalo, and we have talent and expertise in Buffalo where we have an opportunity to become national leaders in this area.
So today we find ourselves at the start of a new journey that will lead us to having a generational impact on the health of all those who live in our region.